When Mariam was running, as usual, she felt pain in her chest and she ignored it. While she went to sleep, the pain increased. Hello, Mariam. I am your doctor. You have been diagnosed and symptoms have confirmed that you have heart failure. Don't worry, we will discuss the disease for you and what the medication I choose.
Our part about heart failure. Today I will discuss with you etiology of heart failure. Heart failure caused by systemic hypertension in 75% of cases. Structural heart change such as valvular dysfunction caused pressure or volume overload on the heart. Heart is unable to pump enough blood to meet tissue auto requirement. 1. Congenital heart defects. 2. Severe lung disease. 3. Diabetes. 4. Severe anemia. 5. Overactive thyroid gland. 6. Abnormal heart rhythms.
The pharmacological class is beta blockers. Beta blockers are treat high blood pressure when other medication have not worked. It also prevents specific hormones in the neurological system. Beta blockers must be taken exactly as prescribed by doctors, and it's commonly given once or twice daily. The pharmacological drug of beta blockers is first atenolol. It's used to treat high blood pressure and arrhythmia. It also prevents chest pain caused by angina. It helps also to prevent future heart disease. Second, labetalol. It's used to treat excessive blood pressure and manage angina in the long term. It also covers essential hypertension, hypertensive, and pregnancy hypertension. It also improves blood flow and lowers blood pressure by relaxing blood vessels and reduce heart rate. The last one is metoprolol. It's an impact on the heart and circulatory system, which blood flow through arteries and veins. It's also used to reduce your chances of dying or needing to be admitted to the hospital due to the heart failure.
What is a heart failure? Heart failure mainly occurs when initial activities of heart muscles do not pump during this period. Fluids can be producing inside the lungs, which are also responsible for getting the breathing problems. The most effect and initial sign of this heart failure: dyspnea, chronic cough, wheezing edema, nausea or lack of appetite, a high heart rate, confusion or impaired thinking.
Heart failure is a long-term condition that requires ongoing treatment. However, with continued treatment, heart failure symptoms and signs may improve, and the heart may become strong. Doctor may be able to treat heart failure by addressing the underlying cause. There are several types of heart failure medication. Angiotensin converting enzyme ACE inhibitors, beta blockers, and angiotensin type 2 receptor blockers. Angiotensin type 2 receptor blocker have the same benefit as ACE inhibitors and are used as a substitute for patients who can take ACE inhibitors because they cause a dry cough, which is the most preventable side effect. Also, beta blockers are slow down the heart rate and reduce the risk of sudden death. These medications are effective by using them prophylactically to prevent heart failure.
Atenolol is classed as beta blocker. It works by blocking the action of certain natural chemicals in your body, such as epinephrine, on the heart and blood vessels. This effect lowers the heart rate, blood pressure, and strain in the heart. And it's used to treat hypertension and irregular heartbeat. Labetalol acts by blocking alpha and beta adrenergic receptor, resulting in decrease in peripheral vascular resistance without significant alteration of heart rate or cardiac output. Metoprolol is a beta-1 adrenergic receptor inhibitor specific to cardiac cell with negligible effect on beta-2 receptor. This inhibition decreases cardiac output by producing negative chronotropic and inotropic effect. Pregnancy drugs are categorized by their effectiveness by the FDA. Labetalol falls into category C, which animal reproduction studies have shown a risk to fetus, and no adequate and well-controlled studies have been conducted in humans. Second drug, atenolol, falls into category D. There is evidence of a human fetal risk based on adverse reaction in human trials or studies, but potential benefit may justify the use of drug in pregnant women despite the risk. The third drug, metoprolol, falls into category C. Pregnant animals were given this medication and several babies were born with the problem.
Side effects. All medicines have side effects, and each person's side effects may be different. Beta blockers have few side effects, especially at lower doses. In general, adverse effects are mild, transient, and occur early during treatment. The drug Trandate, that's mean labetalol tablets, to discontinue treatment in 7% of controlled clinical trials of 3 to 4 months duration. There is many side effects for Trandate, and there are dizziness and vomiting and skin redness and tiredness. And now I will talk about metoprolol. Metoprolol may cause some unwanted side effects, although not all these side effects may occur. If they do occur, they may need medical attention. And there are many side effects for metoprolol, and they are dizziness or lightheadedness, tiredness, depression, nausea, dry mouth, and stomach pain. And now I will talk about potential food interaction. It is a food-drug interaction defines that a specific nutrient or compound within the food changing the way the body metabolizes the medication. Labetalol can interact with beverage as caffeine can decrease the effectiveness of the drug. And we have the last one is metoprolol is a beta blocker that increases potassium level in the blood. High blood potassium level can occur when beta blockers are taken with potassium-rich foods such as meat, milk, bananas, and sweet potatoes. And the last, I will talk about potential drug-to-drug interaction. A drug interaction is a change in the action or side effects of a drug caused by another drug. First, when labetalol is used along with a multivitamin containing minerals, the effects of labetalol may be reduced. It is recommended the labetalol and multivitamins with minerals be given at least 2 hours apart. Taking atenolol with keratin medication for the heart may cause you to have very low blood pressure and heart rate. The atenolol oral tablet can interact with other medication vitamins. For the metoprolol, mental health medications such as borborygin, fluoxetine, paroxetine, clonidine, thyroidazine, other medications, all of them can be potential drug-to-drug interaction.
The drug of choice for treating heart failure is labetalol, which prevents symptoms and effective in treating excessive blood pressure and angina.
So, in nursing consideration have 3 medicine. So the first of all, the atenolol If GI trouble occur, take the medication with food. Do not stop taking this medication unless your doctor tells you to do. If you feel dizzy or weak, don't drive or do something harmful to you. These are some of possible negative effects, for example, disease, lightheadedness, loose appetite, nightmares, sadness, and sexual dysfunction are all symptoms of this condition. Also have breathing problem. For example, can affect you non-consensual cough, swelling of the limbs, or slow pulse. Okay, confusion, sadness, rash, fever, and sore throat are all symptoms to report. So the next medication is called lipitatol. So it is the most common time for possible hypotension to occur is when plasma levels are at their highest. For example, from 2 to 4 hours after drug administration. So all posture change, especially from laying to upright, should be done equally and in phases. Hypotensive effect in older adults are extremely dangerous. Do not drive or engage in any other potentially dangerous activity until the drug's reaction has been determined. Note that the majority of the side effects, such as, for example, scalp tingle, are moderate, temporary, and those related and occur early in treatment. Make sure you keep all your scheduled appointments. So the third medication that is called metoprolol. So stop taking this medication only if your doctor tells you to do. Do not chew or cut extended release tablet. They can either be crushed or chewed. You can divide the toprol X large pills at this core. Divide the tablets must be consumed whole, not crushed or chewed. So the following adverse effects are possible. For example, dizziness, tiredness, lightheadedness, impaired visions. For example, avoid driving or dangerous activity, loss of appetite, eat frequent short meals, nightmares, depression. Consider a medication change. Sexual impotence, breathing problems, a non-consensual cough, swelling of the extremities, a slow pulse, confusion, sadness, rash, fever.